Well, hello, Believers Church. I hope you're doing well. What we wanted to do today, just to serve you guys, is provide some information by talking to Dr. Matt Acker. Many of you guys know Matt as one of us at Believers Church. And if you don't, he's been with us for a long time. And in fact, Matt has the dubious distinction of, I think, actually resuscitating a person in our sanctuary once. That actually happened. But Matt is part of In His Image International, which is a group of docs that they specialize in missions work, and in particularly going out to crisis situations. They've been all over the world in hot spots, if you will, earthquakes, tsunamis, you name it. So this present situation isn't new in terms of its intensity, except for the fact, for these guys, except for the fact that it's in Tulsa. It's not in another country this time. And currently, the In His Image docs are most of the COVID cases for the St. John's system right now. So Matt is very, very well acquainted with what's going on in our city. So Matt, I just want to say thanks for offering yourself to us.
Yeah, and thank you, Matt.
To really learn something here. So we appreciate your time.
Absolutely. Happy to help.
Well, we're just going to jump straight into some questions here. Hopefully we'll cover the kind of questions that people in our congregation are interested in knowing. And of course, whatever you want to add to it, please do. So I'll just start and just say kind of a generalized question. How serious of a situation are we in really?
Yeah, that's a great question. And I think it's very serious. And I think the challenge is that this is a whole new virus. People kind of can compare it to the flu, but I think that's real error to make. The death rate is much higher. How it's affecting our healthcare systems is much more intense. So the number of people that are gonna die from this, that are gonna get critically ill, that are gonna need hospital beds, ICU care, is tremendously greater than with the flu, and we just don't have immunity to it. None of us have immunity to us, and so we can't fight it really until we build that immunity, and that's going to take months to years to do that in a community. So yes, it is serious, and we see what's happening in the West Coast and certainly in New York, and we can say, thank the Lord that we have a little bit of reprieve, time to get ready for this. Unlike they have not had that. So yes, it's serious.
Wow, that's really helpful. And I'd never even thought about the fact that we don't have any immunity, any of us have built up to it.
Right.
Let me ask you this. We're all inundated by information, and some of that also kind of makes it hard to know who to trust, where to go. Yeah. What are some of the best sources of information you would send us to?
Yeah, I think there's a couple of websites that I would say are my go-to, and I would encourage you to go look at those. The first one would be the CDC coronavirus page. I think that's excellent as far as just, what do I do if I get sick? What are the symptoms? What are the experts saying? Whole bunch of information there that'll be helpful for you. And then Johns Hopkins website also, and that's Johns Hopkins, and it's coronavirus map. And you can look at a lot of data there, get a lot of great information, see what's happening in Tulsa, in Oklahoma, in the world, anywhere really you want to see. And I think those are probably my go-tos, and I would encourage you to see those. If any of you are really geeky and you want to dig deep, like there's one website called the World-O-Meter, and you can look up any stat you want, certainly about the coronavirus, but others on there, and they keep those updated.
Okay, that's really helpful. Cindy, you had some questions.
Yeah. So Matt, we've heard so many things about how this is actually spread.
Yeah.
Like, how is it spread exactly? I mean, as much as we know, it seems to be changing.
Yeah. Well, I think number one, it spreads with somebody who's sick, and they cough or sneeze and you're in that vicinity and you inhale it into your lungs, into your mouth, into your nose, into your eyes. That's by far the most usual way that it's spread. Of course, it's an air droplet type virus. So you sneeze or cough on something, or you wipe your nose with your hand and wipe something, touch something, then the virus can last on surfaces for up to 72 hours or 3 days. So it's definitely possible to touch those surfaces, touch your eyes, touch your nose, wipe your mouth, and then get the virus that way. Lately too, it's seeming like that the virus can be spread even fecal oral route. And that means somebody who has diarrhea, nausea, and vomiting because of this virus that can contaminate things. You can touch things and contaminate yourself or others with that. So there seems multiple ways, but by far and large, it's the coughing, sneezing, runny nose near people that's going to cause the problem, and really close contact with people.
So what would you say to somebody, we have to go get food at the grocery store, stuff like that, regarding social distancing?
Yeah, great question.
What would you advise them?
Yeah, I think that's a great question. I think number one, the best thing that we can all do, and I'll probably say it multiple times, is to stay away from one another and to stay as contained as we possibly can do. And I'll talk about that a little more later, because that's probably the most important thing we can do to take care of ourselves, to take care of our families, our community, our city, and those people working in the hospital. I mean, that's what we can do to love one another well and to love our city and our community well. So I think when you do go out, I think it's important to just be aware of, I need to keep distance from people. One of my family members was at Lowe's the other day, and it was a weekend and it was packed. And the people were standing back to back in lines, that kind of thing. So I would advise, when you go into a store, you just stay away from people. It's uncomfortable, it's weird, but you're talking to an associate, you just give them quite a bit of space. And if you're standing in line, back up and give the next person in line lots of room, and that will hopefully help other people to do that the same. I think you ought to wipe things down that you touch, absolutely. So whether that's anything that you touch really, but certainly in the store. And then when you come home, it's probably very wise to wipe some of the bags down, and at least the outside containers of things that you have, with one of those Clorox wipes. Soap and water will even work, 60% alcohol. Anything like that can be beneficial. And I would say this though, I would say anybody who has any medical problems such as diabetes, heart disease of any type, certainly lung disease like emphysema or COPD, asthma, those people I would advise not to go out, at least not to go out around other people. Being outside is okay, it's just other people.
Even asthma. Wow, okay.
Yeah, I would be very careful if I had asthma, for sure.
Okay. All right. One more I have regarding family. Taking care of family members who might be sick.
Yes.
What do you recommend for that?
Yeah. I think if they have upper respiratory type things like cough, certainly fever, runny nose, their body's aching, that kind of flu-like symptoms, I would say to try and isolate them as much as possible. I would like you to think this is probably not coronavirus as far as reality and as far as not breeding fear, but as far as taking care of each other, I think we ought to think anything like that could be coronavirus, and so we have to take precautions. So I would send them to a room that has a room and a bathroom, and while they're sick, pass them their food, put it down on the floor, knock, have them collect it. You can talk over Facebook or the phone, but I would say create as much space as you can. And I think this is especially important, again, for those people who might have other medical conditions. And the other thing I would say, and I forgot to say, is but anybody over 60 is really at a much higher risk, no matter what, than those of us who are younger. So I would just say even more important for those folks.
Yeah. All right.
Yeah.
Roger?
Yeah.
Thanks, Matt.
So you mentioned a few of the symptoms, Matt, but are there any other symptoms that are unique to corona, or just help people with a little bit of like, how do I know if I might have this? What are some of the symptoms I would see?
Yeah, right. That's a great question. I think the major symptoms by far are cough, fever, and body aches. People also get short of breath, but that usually comes kind of in the middle or to late. That's another one that's it's concerning, but it happens a lot. I think there's a lot of other things like sore throat, runny nose, headache, nausea and vomiting and diarrhea that sometimes can happen, loss of smell, loss of taste, but those are not as usual as they are with the regular flu. So if I had those, I would be thinking, oh, I might have a regular flu or something, but if I had severe cough, fever, I'd be much more concerned about the coronavirus.
Yeah, thanks. That's helpful. So one of the things which there seems to be a lot of confusion around is the issue of testing. So when do I need to get tested, and where do I go to get tested? What is that? Let's talk a little bit about that.
Yeah. So right now in the whole system, especially here in Tulsa, that's true. We just don't have enough tests to test everybody. So we're really conserving those tests for those people who are very sick or have other problems or are in the hospital, so that we know how to treat them the best way. But there are other tests available. So the first thing that you would do is if you're young and you're healthy and you have mild symptoms, there's no reason for you to be tested. It would be great if we could test everybody, but we can't. So those people really, it's not going to help us to know necessarily whether they have it or not, but those are the type of people who need to stay home, Tylenol for fever, drink lots of fluids, get rest, isolate yourself as much as you can, and just take care of yourself. And only if you get severe symptoms would I say call your doctor and you might need to be tested. But right now we're testing those people who have these other medical conditions and they have severe symptoms. So they're either over age 60, heart disease, diabetes, high blood pressure, lung diseases. So those people are currently getting tested. And generally, it's not going to help the rest of us. Of course, if we're a healthcare worker and we're sick, that's another population that should be tested. So the best way to enter into the system is basically to call your primary care doctor. Most of the systems now have triage nurses that are set up to take your call, to talk about how sick you are. If you need to be tested, where do you go in that system to be tested? And then also what you can do at home to stay safe. And if you're sick enough to go into the hospital.
Great. I noticed you said take Tylenol. Is ibuprofen not helpful? I've read somewhere don't take ibuprofen, and that's pretty common.
Yeah, I think for most of us who are healthy, ibuprofen is not going to be a problem at all. Bottom line is we don't know the answer to that. It's theoretical, but it doesn't look like it's a big problem. So if I needed it, I would take ibuprofen. If there are other reasons I shouldn't take ibuprofen, though, I wouldn't take it. But I do think Tylenol is the safest bet in this coronavirus.
Great. One last question for me, Matt. If you've been exposed to the coronavirus or you actually have come down with it, talk about the timeline for quarantine and what that looks like.
Yeah. So quarantine is really when you put yourself in isolation and you don't go out and you don't get near other people as much as possible. And so the incubation period, or the time it takes from contacting the virus to really getting sick, is anywhere from 2 days to 14 days. So 14 days is really the gold standard as far as how long you need to be quarantined to be able to say, yes, I'm not going to get the virus. 3 to 5 days looks like it's the most common time period to where you'll develop symptoms. So if you've made it more 3 to 5 days, you can probably start to feel pretty good. 14 days to be very safe.
Great, thanks.
Yeah.
One question, Matt, that came to me is, we're trying to help some people. So for instance, there are some of our families at church who have elderly that can't get out and get food. Also, there's benevolent situations, where people are in dire straits, and we help people all the time anyway. It's just part of what we do. What would you advise us in either of those situations where we're trying to help others, but know that we don't want to put them at risk or put ourselves at risk?
Yeah. I think the big thing is just to always think about distancing. So if you're going to take food to somebody, you go, you knock on their door, you put the food down, you back away, and then they can come and pick up the food. If you want to wear gloves and wipe it down, I think that would be very good, but you don't necessarily have to do that. The big thing is staying away. And if you want to talk to them a little through the door, make sure you're at least 6 feet away. 6 feet seems to be the magic number. And then just chat with them from a distance. I say that's probably the most important thing. If you're sick, though, if you have low-grade fever or cough, even if it's mild, you can potentially spread this disease. And so that's very important to know. So if you're feeling that way, I would say do not go out, and certainly do not go near other people who are either older than 60 or have other diseases. And of course, cancer, I didn't mention. Anybody who's active cancer is at high risk. So you just want to we want to protect our people, yeah? And that's the best way we can do it. And so connecting with them, certainly through the phone, FaceTime, is so important during this time.
So in other words, those of us who in the past maybe just felt like it was noble to muscle through a sickness, that's exactly the opposite of what we should be doing right now. Is if you feel anything at all, just go ahead, take it easy.
Take it serious.
Yeah, and no, we don't need to be part of that activity until we're feeling better.
Yeah.
Matt, I have one more question.
Sure.
If you talked about bad symptoms when they get bad, what exactly would that look like if a healthy person got sick? At what point would you say, okay, if this happened, you need to go to the hospital or go to the emergency room or call your doctor?
Yeah. So I think there's 2 categories. I think if you're young, if you're under 60 and you're healthy, it would only be if you have significant shortness of breath. If you have shortness of breath to where you can't get up and walk very far, and you're like, that really makes me short of breath. Or if you're starting to get kind of bluish lips or really pale, or you get severely dehydrated, then those are times that I would call. If I had high fever, if I was feeling really bad and had a terrible cough, it's better to stay at home and to take Tylenol, over-the-counter cough and cold medicines, drink a lot of fluid, and get a lot of rest.
That is so helpful.
If I was in the older category, though, or I had any underlying illness, if I was mild or short of breath, or if I had chest pain, or then I would have those folks call their doctor and ask what they need to do next. One important thing I want to say, and we might not think about it usually, but before you go to the ER, before you go to your doctor in this situation, before you call 911, or if you had to call 911, you let them know your symptoms, and if you've been around anybody who has this COVID-19 or coronavirus, and they will tell you what to do. And that's changed from usual for us.
Okay. Very helpful. Thank you.
Welcome.
So Matt, I'm gonna pan out then to just, this of course what everybody's asking and trying to predict is how long will this last? So what is your best guess or your information that you're privy to at this point of wondering how long this is going to go?
Yeah, that's a great question, Gyle. I think best case would be 4 to 6 weeks. Worst case would probably be 3 months. I think I just heard today one of the experts in Oklahoma is predicting that the peak is going to be June 1st. I hope and I pray that with the social distancing that we're doing, that we're going to have a flattening of that peak that you've heard of, where we have a slower growth. We're going to have fewer numbers, and I feel like that's what we're praying and we're believing, and hopefully we're being wise. I do think in the next couple of weeks, though, we're going to have a better idea of where we're going as Oklahoma. And so it's going to be longer than people think. And part of that is because it takes a long time for this to develop in the community or even in somebody's or with somebody's health. So really, when you're seeing what's happening now, it's almost what started a week to 2 weeks ago in reality, what was moving around then. So, yeah.
Yeah, because kind of the big question, is like, when do you think life will get back to normal? So let's say it peaks June 1st.
Yeah.
But then I've also heard, I think it was the SARS and that kind of thing and re-entering too quickly. Yeah, what are you like? We would love to have church service just to see humans again, that aren't on a screen. But of course, we want to do that till we know we're able to love others well by being precautionary. So what are your thoughts on that?
Well, my best hope would be 6 to 8 weeks. And that's probably the best hope. I think worst case, again, would probably be 3.5 months, maybe 4 months. It will probably come in a big wave. And hopefully that wave will be diminished here. But then there's probably going to be times in the future where certain cities or certain states or counties are going to have to kind of go back into some sort of social distancing again, because this will probably come around again. It'll probably come back here and there until we develop enough immunity in the whole community, just like we do with influenza, to really be able to protect most of the community. So it could be like whack-a-mole here in the future. And I think it's just important for people to realize that things have changed for a while.
So in other words, it's overly simplistic to just think, okay, we get through this thing, we're over quarantine, coronavirus is done. The truth is there's something lingering that's going to be part of our system for a while.
Yeah, I'm afraid so, until we develop, vaccines, until a lot of our population gets it and then is immune to it. So once you have it, it looks like you're immune to it. So that's going to take a while for that to happen.
Okay.
Yeah.
Okay. Roger or Cindy, do you have any other questions that have come to your mind here in this time?
No, I'm just grateful to hear it from you, Matt. We trust you.
Yeah, I would just want to know, Matt, how can we pray for you and the workers on the front line, the healthcare workers? Is there anything that I know, by staying away and social distancing, we're actually helping you guys, but anything specific, and how can we pray?
Yeah. Well, I would say, be praying right now for, I think our leadership in government and in the city. I think they've done an outstanding job, and we just need to keep lifting them up for wisdom. because they're making some very, very difficult calls. I think the doctors and the nurses who are working in the hospital, I think we can pray for them. The people that you know who are doctors and nurses who are kind of on the front line, just pray for them, because we need to be protected. We need to be wise. We need to have stamina. And so that would be great. The other group of people that I'd ask you to pray for are missionaries throughout the world. I think some of them are being hit hard already. You know, some of our doctors are throughout the world, some are even in Wuhan. Actually, Wuhan has been through the worst of it, and our folks there are actually starting to get out of quarantine after 60 days, if you can imagine. And we're thankful for that. But our other doctors and missionaries in these developing nations, it looks like the wave coming to the developing nations is happening a lot later. It's just starting now. And so my heart and my prayer are for those two who are out there.
Wow.
I have a couple more thoughts I had, if it's okay, Gyle.
Please.
I think sometimes we look at the worst case scenario, and I think sometimes we have to do that. But in reality, 80% are going to have mild illness. But I think we have to act like, when we protect one another, we have to act like, yes, this is very serious. I could potentially have it at any time, certainly if I'm sick. And so in that way, we need to really act like it's all around, so that we're wise and we're smart and we're loving one another well. I think the better you can do at protecting yourself and staying away from people is very wise. I just had a few things that I want to encourage people to do. I think connecting with Jesus, having your quiet times, your sacred rhythms, and just doing that no matter how you feel during this time is just so crucial. I think having good sleep, and we're talking about things that kind of enhance our immunity, our natural immunity. So 7 to 8 hours of sleep, getting some regular exercise, getting out and just enjoying a walk or a bike ride or a run. You know, it is good to be outside. It's hard to catch this when you're outside unless you're in a big group. So try and get outside. Don't watch too much news. I know I have to limit how much news I watch and how many websites and data I look at, because I just don't need it all the time. And I put a limit on that, and I would encourage you to do that. I think that would be helpful. I think things like, if you are feeling stressed and fearful, and you're thinking about worst case scenario too often, is just to do some deep breathing techniques, and to do some of the things that, Gyle, you encouraged us to do last Sunday. That was so important and so good, about how to deal with anxiety and how to deal with some of those intrusive thoughts. And then please connect with people. If God puts somebody on your mind, call them, see how they're doing. We have to fight against isolation right now, and we have to look out for one another, like I know we're doing. And I just want to encourage us to keep doing that. And any way that we can connect without getting together, I just want to encourage us to do that. And then good nutrition. I know when I'm home a lot or I'm stressed, I want to get that ice cream more and more. But really having good nutrition, not skipping meals, drinking enough water, again, to increase your immunity is so important. And I know most of us do not smoke, but if you do, I would just implore you to use this as motivation to really quit once and for all, because that can be so detrimental to your health and detrimental to really how you do if you got this virus. So just encourage people to live well during this time, and to really pray for one another in our city and our community and our fellowship. And just believing that God can blunt this curve if we're wise and in his power. So just encourage you with that. I know 2 Psalms that have been incredibly helpful for me as a doctor when I go in and I see people who have potential coronavirus is just Psalm 91 and Psalm 46. and just meditating on them, memorizing portions of them, praying those through multiple times in the day has been helpful. And yeah, just thank you for your prayers for those of us who are in the midst of this.
Well, to that end, we'd like to pray for you if you don't have any other comments you'd like to make. Is that okay? So here's what I want to encourage you, all of Believers Church, whoever's watching this video right now. While this is a recorded deal, your prayers, right when you're in this, actually matter. God's going to hear them, and God's going to answer them. And there's something about agreeing together. Jesus said if we'd agree together, just 2 or 3. So we've got enough here on this call, but we'd like to see hundreds, if not more, agreeing to pray over Matt and those who are really putting themselves on the front line. You may have friends. We have a list at the Smith House of people we're praying for every night at dinner that are healthcare workers and those at risk. And I know that the living God hears our prayers. So let's join our faith together in this moment, and I'll pray. Father, we worship you. Thank you that we are not stuck with our best solutions. We're not stuck with our best ideas. We're not stuck and limited to what we can do, but we have access to the living God who spoke the world into existence. You sustain the world by your powerful word, Hebrews 1 tells us, and that you are the Omega. You're the one bringing this to a close when you decided to be so. And so that through Jesus, we have total access to the throne of God's grace. Hebrews says that we can come to you with confidence and receive mercy and find grace to help us in our time of need. So we do that right now. We do that on behalf of Dr. Acker, on behalf of the In His Image doctors, and all the healthcare workers and first responders that are working throughout our city, indeed our nation, Lord, that you would do something discernible and powerful to demonstrate your goodness to us. Bless these guys, bless their families, the stress that their families feel as they come home each day, wondering how their spouses or loved ones are doing in this scenario. Lord, I pray there'd be unusual grace, the grace of Jesus, that's the sacrificial Jesus grace, that Lord Jesus, you walked through to the cross, but knowing that we always have hope of resurrection, that this is always going to be something beautiful, something better than we hoped, because you have been raised from the dead. And so, Lord, I pray that over Matt and their whole team, and ask you, Lord, to walk us through this and show off how good you are. In Jesus' name we pray. Amen.